most children in the United States don't have access to school reentry programs, and that's something we need to point out, not only in the United States, but in the world. So it's unique. So to be able to speak about our kids and being able to expand the program to now do it for children with hematological disorders is also a gift and an honor to work with all of you in the schools. We call ourselves a school reentry program because that's when we really got started, but it's not just about school reentry. We actually start the process at the time that we meet families at the hospital, but we work really hard to get the kids back in school. Once a family learns that their child has a life-threatening illness and they're in the hospital and they're being hit with new medical terminology and treatments that are unbelievable and the whole world is upside down, we still are asked early on, when can my child go back to school? Anxiety, depression, fear, some of the things can really be minimized when the kids work through these programs. We talk to the school, we pick a person or we identify a person who wants to collaborate. And we're very specific what the child's diagnosis is, what that child's treatment is, what that child's individual needs are. Here our job or our goal is to prepare the classmates for the child's return. So the program's not only focusing on our patient, we're also worried about the peers.
The transition between the child coming from Stony Brook back into school is incredible. They meet with our support staff, including the nurse, the administrators of the building, the school psychologist, and they basically fill us in from A to Z in regards to every need that this child needs, what we need to do for him academically, educationally, psychologically. It's an awesome program.
Most of the therapies in childhood cancers, especially for the kids with brain tumors and leukemia, are very long, especially in comparison to adult therapies. We're talking about a year, 2 years, 2.5 years, 3 years. We're not going to keep them home for that long. We discuss the presentation with the child. Other kids, they want to sit back and they want to pretend you're not even talking about them.
We have a student presently who has been diagnosed with a cancer. He came in very shy, very upset. He had lost most of his hair. After meeting with the reentry program, it has been a world of difference. He now has tons of friends. The kids now think he's their hero, and it's just so overwhelming and incredible.
When we talk to parents, they're really worried about, is the kid going to be targeted? Are they going to be teased? Are they going to go back to school just to be exposed to a whole bunch of things at school?
Hi, my name is Zach Liberty. I am 13 years old. I am a cancer survivor.
When Zachary first came to Stony Brook, he was quite ill. We didn't know why. So we came and met a very supportive team. He was diagnosed with ALL leukemia and was on a treatment regimen for about 3.5 years. With going back to school or really being different. He didn't want to be different.
The Stony Brook nurses came to my classroom and gave a whole presentation in front of the class.
They were able to give a presentation on the children's grade level that would explain what Zachary had gone through with his chemotherapy treatments, explain to the children, mainly the children, that this was not something that was catching. It was, and the kids were all very, very involved and into it.
We're talking about hope. It's a time of turning fear into hope. Going back to school is the right step in the right direction.